Hello, this is Ken Muhich from the Fibromyalgia Wellness Center. And next thing we're going to cover is something that's very, very important. It's called mapping. This is going to actually help us to find whether or not a patient is improving, how fast, and what amount of guanfacine they need to take to reach that level of improvement that has only been dreamed of. In other words, being healthy, pain-free. Mapping involves an individual that we need to have the availability of both arms unclothed and both legs. And what we're going to do is show you what mapping actually involves. If you don't do mapping, you will not know how much guanfacine to take. Consequently, you will have probably a lack of success in the protocol. There's so many people that actually read certain books, Dr. St. Aman's book on protocol, on guanfacine, and instead of actually someone actually mapping the individual, they just try to take the guanfacine, and it doesn't work. You have to do mapping to actually find out the actual amount of guanfacine you need to take. So it's very, very simple. The patient just relaxes their arm, doctor's hand, and we just go lightly feeling for any lumps, bumps, anything that could be pea size, it could be marble size, it could be fluid filled areas, all the way down to the hands and fingers, and also the back of the arm, feeling along this area here to see what we might find as far as any areas. And then what we do is we place this on a sheet of paper. And this is what's called mapping. Keep in mind, we do both arms, both legs, and when we're finished, especially if the patient obviously is already on guanfacine, then there is one area that we need to check to see whether or not the patient is taking the correct amount of guanfacine. Remember, you take 300 milligrams twice a day to start with. Then you do mapping. Now, they should have a bad reaction initially within maybe 24 to 48 hours. A bad reaction is something, additional pain, headaches, back pain, leg pain, weakness, difficulty sleeping, whatever it might be. If that is true, the guanfacine is actually working, believe it or not. But those severe reactions actually reduce over a period of time. You feel better and better. Those periods of time where you actually are pain-free actually increase longer and longer, and those severe pains are actually little lumps and bumps, so to speak, that go along. But this is the one area you really have to check to make sure you find out what amount of guanfacine that you're taking. Just run your hand, and this is one where you have to go into the tissue from the hip bone to the middle of the knee, right here, right across here. If there's pain that is elicited, you ask the patient, is there pain? Or as a fibromyalgia patient, ask yourself, if there is pain when you do this, what you have to do is you have to double the amount of guanfacine that you're taking. So if you're taking 300 milligrams twice a day, you have to increase to 600 milligrams. And keep on doing that, see what kind of reactions you have. Keep mapping yourself. I would say you map yourself at least maybe once a week to check and see. And if you continue to have this, then you have to increase it again to 1,200. The vast majority of my patients that we've worked with, I think the maximum that we've ever had is maybe 1,200 milligrams twice a day. The vast majority of patients, some of them actually stay at 300 twice a day, some of them at 600. Some we may have to change where we might have to take 1,200 milligrams in the morning, 600 in the evening. We vary that, we check with that. That's why it's important that you contact us if you have any questions. Again, Fibromyalgia Wellness Center, Fibro Wellness Center, we're always glad to see you're back. Make sure you are not afraid to contact us for any questions you may have. Thank you very, very much. Dr. Ken Muhich, Fibromyalgia Wellness Center, we're always glad to see you're back, and other body parts. Thank you.